Today's topic is hamstring injuries treatment and management. The hamstrings are three muscles grouped in the back of the thigh, mainly biceps femoris, semitendinosus, semimembranosus. Types of injury modes. Hamstring injuries can be due to contact sports such as football, sprinting, martial arts, basketball, or non-contact sports such as golf, gymnastics, and different dance forms. The main cause of hamstring muscle strain includes muscle overload. As you can see in the picture, during sprinting, the hamstring muscles are lengthened and loaded as the back leg pushes off to propel the runner forward. This can happen when the muscle is stretched beyond its capacity or challenged with a sudden load. During sprinting, the hamstring muscles are contract eccentrically as the back leg is straightened and the toes are used to push off and move forward. The hamstring muscles are not only lengthened at this point in the stride, but they are also loaded with body weight as well as the force required for forward motion. Gymnastics hamstring injury. Hamstring strains are common in gymnastics due to the explosive combination of power and speed used during the several movements in the sport. Hamstring strains may be minor, which involves a small number of muscle fibers being damaged, or it could be more serious, which will include a partial or a complete tear of the muscle. The main causes in gymnastics, hamstring strains are usually caused due to sudden increase in speed, which can occur usually during the run-up stage of the vault or on the floor in gymnastics. Symptoms are minor strains, which usually leads to pain after physical activity, while more serious strains will result in the athlete pulling up in extreme pain. Other symptoms include swelling, restricted movement, and bruising, usually appearing 24 hours after the injury occurred. The treatment for hamstring strain. Minor strains will require RICE combination, that is rest, ice, medication to control pain and swelling around the muscle. More serious strains require surgery, and the gymnast may have to use crutches for a period of time to prevent the affected leg wearing weight. Major strains should be rested for a long period of time to allow the muscle time to heal. Once the recovery progress has begun, physiotherapy will help to gradually increase the range of motion and the strength around the muscle. Another common cause of a hamstring injury is martial arts. As you can see in the picture above, it occurs when a pull or tear in the hamstring occurs while performing a high kick. For example, when the client may attempt to force their body to perform techniques that are beyond their skill level. The severity of hamstring injuries can be reduced by hamstring stretching. Cross training can also help build up resistance and strength to the muscles around the hamstring, especially through rigorous cardio. Hamstring injury is another main cause, dance forms. Hamstring injuries occurs in all types of dance, causing pain in back of the thigh up to the buttock area or down low where the hamstring muscle connect below the knee. Kick lines, as you see in the picture above, are those done in precision dance, particularly keeping a stress in the hamstring muscle group. What is a kick line? It means lifting the leg up in a kick that puts the muscles on full stretch at the end range of hip and knee motion, followed by a strong contraction of the hamstring muscle to bring the leg back down. Hamstring muscles are vulnerable during that quick transition from full passive stretch to a strong active contraction, particularly if the dynamic warm up or cool down after the previous rehearsal or the performance was not done properly. Now let's see how to grade the hamstrings. In case of hamstring strain, you grade it in three levels. Grade 1, a mild muscle pull or strain at the back of the thigh with no loss of muscle strength or mobility but is painful. Grade 2, a partial muscle tear. It's painful, tender, swollen, bruising, mild loss at strength. Grade 3, a complete muscle tear. Grade 2 plus, a popping sound at the time of the injury. Risk factors and treatment methods. Mainly the risk factors are muscle tightness, muscle imbalance, muscle fatigue, poor conditioning. Treatment methods: RICE protocol, immobilization with a knee splint, physiotherapy for knee flexibility, strength retraining and balance and proprioception. If the above fail, surgical treatment, that is tendon avulsion injuries or a PRP injection therapy. Over here we can see the physiotherapy management with eccentric exercises, sports deep tissue massage, dry needling and kinesia taping to improve the flexibility. Let's look at the rehab protocol for hamstring muscle strain in different phases. The phase 1, week 0 to 3, your main aim and goal is to protect the healing tissue, minimize the atrophy and strength loss, prevent motion loss. Your precautions include avoid excessive active or passive lengthening of the hamstring and avoid an antalgic gait pattern. Your rehab will include icing 2 to 3 times daily, stationary bike, submaximal exercise isometric at 90 degrees, 60 degree and 30 degree, single leg balance, balance board, soft tissue mobilization, pulse oximetry, ultrasound, progressive hip strengthening, pain-free isotonic knee flexion, sciatic nerve flossing, TENS, and the criteria to progress to the next phase includes normal walking stride without pain, pain-free isometric contraction against 50 to 75% of submaximal resistance during prone knee flexion at 90 degree. Let's look at phase 2, week 3 to 12. Your main goal is to regain pre-inferior hamstring strength, progressing through full range of motion, develop neuromuscular control of trunk pelvis with progressive increase in movement and speed, preparing for functional movements. Your precaution: avoid end range lengthening of the hamstring if possible or if painful. Rehab includes post-exercise icing, stationary bike, treadmill, moderate to high intensity, which should be pain-free and increase the speed and the stride. Isokinetic eccentric in non-lengthened state, single leg balance, windmill touches without weight, single leg stands with perturbation, supine hamstring curls on the cerebral, soft tissue mobilization or instrument assisted soft tissue mobilization, Nordic hamstring exercise, shuttle jump, prone leg drop, lateral and retro band walks, sciatic nerve tensioning. To avoid end range lengthening of the hamstring and to develop a neuromuscular control between the trunk and the pelvis, we need to follow the eccentric protocol. What is eccentric protocol? Once the non-weight bearing exercises are totally tolerated, start low velocity eccentric activities such as stiff leg deadlift, eccentric hamstrings, hamstring different exercises, squats, etc. What is the criteria for progression to the next phase? Full strength, which is 5 out of 5 without pain, in front line knee flexion 90 degrees, pain free forward, backward, and walking, jogging, moderate intensity, strength deficit less than 20% of the uninjured limb, and pain free maximum eccentric in a non lengthened state. Okay, your goals, precautions, and rehab. Your goals include symptom-free during the activities, normal concentric and eccentric strength through full range of motion and speed, improve neuromuscular control of the trunk and pelvis, integrate postural control into sport-specific movements. Your precautions involve train with symptom-free intensity. Your rehab is icing again, treadmill, moderate to high intensity, isokinetic exercises in the end range of motion, soft tissue mobilization, plyometric jump training, single leg balance with mill touches, sport specific drills that are for postural control. Eccentric protocol includes squat jump, split jump, double and single deadlift, backward skipping, plyometric jump box, bounding single and double leg, bounding eccentric backwards, eccentric loops, zigzag lateral hops, etc. The criteria to return to sports include full range of motion and strength without pain and length during the training period, bilateral symmetry, knee flexion angle, full range of motion without pain, replication of sport-specific movement at competition speed without symptom, isokinetic strength testing. Let's look at hamstring muscle tear. Hamstring muscle tear is also a common cause because of excessive or extreme stretching or overload during sport, overtraining, poor flexibility in the muscle. More sports involved include soccer, football, and ice hockey. Observation and examination. When a patient comes to you saying that they have pain at the hamstrings, we do observation and examination, and we shall notice the following. The symptoms of a torn hamstring depend on the severity of your injury, like sudden sharp pain, popping sensation at the time of injury, tenderness, swelling, bruising, partial incomplete weakness of your leg, and inability to place the weight on your leg. Again, like hamstring strain, hamstring tear is also graded in the same way, with the grade 1 being mild hamstring strain, also known as pulled hamstring strain, and grade 2 is hamstring partial muscle tear. Grade 3 is the most severe hamstring tear, in which the hamstring muscle is completely ripped off or tears over the bone. Phase 1, immediate post-op 0 to 2 weeks post-surgery, treatment rehab protocol, post-repair. Main goal, allow healing of the repaired tendon, initiate early restricted and protected range of motion, prevent muscular atrophy, decrease pain and inflammation. Weight bearing, toe touchdown weight bearing with crutches. Precautions, post-op hip brace up to 45 degrees of hip flexion, brace at all times aside from exercising and bathing, avoid hip flexion with knee extension. Range of motion, active assisted and passive hip and knee flexion, and hip flexion range of motion up to 60 degrees. Intervention, first one manual therapy. You can do soft tissue muscle relaxation, peri-incisional mobilization, myofascial release to the posterior lateral gluteal and lateral hamstring muscle and fascia, proximal one-third of the lateral thigh. Attain and maintain neutral iliac position, ipsilateral and contralateral to the injury side, and manual posterior rotation to the ilium. Stretching, nerve glides, that is sciatic nerve glides, hip flexor stretch that's like the Thomas test method, and gastrosoleus stretching. Therapeutic exercise, ankle pump, quadricep setting, active assisted and passive range of motion at the hip up to 60 degrees, knee flexion, and upper body ergometry. Criteria to progress, that is more than 2 weeks of post-op. And when you reach 2 weeks to 6 weeks after the surgery, you are in the intermediate post-op stage or phase 2. Here your goal is to resolve the pain and edema, improve the motor control and pain-free function movements. You can allow the person to do 50% partial weight bearing with crutches. Your range of motion must be active assisted, passive hip and knee flexion. Your manual therapy includes car mobilization, that is such as cross-frictional massage to the proximal tendon, including proximal to the attachment of ischial tuberosity, trigger point releases to the hamstring muscles, anterior hip glides without external rotation, posterior or inferior belted hip mobilization as needed for full flexion. Stretching, hip external rotation and flexion, therapeutic exercise, gluteal setting in prone, gluteal setting in supine, low level double bridge, side leg hip abduction, standing calf raise, and strengthening the involved limb. Criteria progress when you reach 6 weeks of post-op. When it is 6 to 12 weeks of post-op, you're in phase 3, late post-op stage. Here your goal is to normalize the gait, gradually progress to full range of motion, improve neuromuscular control, increase strength, proprioception, kinesthesia. Your weight bearing, progressively wean the crutches over 2 weeks to full weight bearing. Range of motion, progressive active hip and knee flexion, active stretching to all uninvolved muscle groups. Therapeutic exercise, double leg bridging with band around the thigh, double leg bridging with wall squeeze, double leg bridging with upper back on the bench, then planking with alternate leg lift, side planking with the leg lift, SLR, hamstring stretch, oblique twist, hip extension exercises. 10 weeks post-op, you should start single leg bridging, back on the floor, foot on the bench. Progress to ankle weight for all the lifts and wall slides, clamshells, push, squat, step up and step down. Cardiovascular exercise, stationary bikes, progress to slow walking and definitely no running. And the criteria required to progress, normalized gait surface, good control and functional movements without antalgic movements, hamstring stretch 5 by 5 and prone, and the knees and 90-degree flexion. Phase 4, that's the transition phase, 13 to 16 weeks after surgery. Again, your range of rehab goal includes full range of motion, improves the power, strength, and endurance and neuromuscular control. Your therapeutic exercise includes gentle stretching of the hamstrings, single floss leg exercises, resisted step up during a sports code around the waist, double leg hamstring roll out, double leg deadlift, short range, progressing to single leg no rotation, progress to single leg with supine rotation deadlift, bridging on the wall, eccentric portion only, double leg progression to single leg. Cardiovascular exercise, walking on the level surface, increase the speed of walking and the distance and prepare for running. Phase 5, that is 16 to 20 weeks after surgery, here an early return to sports phase. Here we have goals. Emphasize on return to the recreation activities. Continue phase 2 to 4 as required. Therapeutic exercise includes progressive strengthening, progressive step up and step down, forward and backward leaning, deadlift with a band, under the stance leg, reverse lunges on the slider, eccentric hamstrings with core strength, eccentric bell swing, kettlebell swing, retro lunge slide. Cardiovascular includes walking, jogging, and definitely no running or speed work or sprinting. Phase 6, unrestricted return to sports 20 to 24 weeks after surgery. The rehab goals again progressively increase the activities to prepare for unrestricted functional return. Therapeutic exercise, isotonic strengthening exercises, continue ROM exercises, running, progressive running, speed, agility, and jump training after 22 weeks. Progress cardiovascular exercise, plyometric progression, double leg up and down, double leg forward and backward, alternating leg bounding, single leg jumping, progress plyometrics or resisted plyometrics, using sports and using sports cord and waist, ladder drills, falling start runs, and mini hurdle run. Thank you for your time.